Let's take a look at how we can apply targeted therapy to breast cancer. Breasts in humans contain mammary glands, which produce and secrete milk to feed infants. Breast cancer typically starts in the ducts that carry milk to the nipples or in the glands that make breast milk. Breast cancer is the most common form of cancer in women and has been studied extensively. Common causes of the disease and its genetic mutations are well known, which makes it a good candidate for targeted therapy. So let's take a look at the causes of breast cancer and how it has helped us make targeted therapies to treat the disease. Researchers have discovered that hormones like estrogen play a big role in breast cell growth and division. These hormones bind to receptors on the surface of breast cells and tell the cell to grow and divide. Due to mutations in the genes in breast cancer cells, many forms of breast cancer have an unusually high amount of these receptors on the surface. This means that more hormones can bind to these receptors and cause breast cancer cells to grow and divide more quickly than normal breast cells. Scientists have found that not all breast cancer patients are the same. There isn't just one hormone and receptor that can cause breast cancer cell growth and division, but a variety of different hormones and receptors that can vary from patient to patient. So, we can have different patients, all with breast cancer, but with different hormones and receptors causing it in each individual. Now, how does this research help with treating breast cancer? Since we know that when hormones bind to these receptors, it causes breast cancer cells to grow and divide, if we could stop this binding, it would help stop breast cancer cells from growing and dividing. And so we have developed targeted therapy drugs that will block hormones from binding to the receptors, and this has shown great outcomes for patients with certain types of breast cancer. So now that we have developed these targeted therapy drugs, how do we go about administering them to breast cancer patients? Like I mentioned before, not everyone is going to have the same type of breast cancer. Breast cancer patients are going to have different hormones and receptors that could be contributing to their form of breast cancer. And so, before we go about administering a targeted therapy drug, we are going to take a tissue sample from patients to determine which hormones and receptors are playing a role in their type of breast cancer. Then, once we know what type of hormones and receptors are playing a role, we can give them a targeted therapy drug that is designed specifically to prevent the binding of hormones and receptors for that patient's breast cancer. And this can help stop breast cancer cell growth and division. And targeted therapy for breast cancer has shown really promising results. One of the earlier clinical trials for targeted therapy in breast cancer was for a drug called TAM. In these clinical trials, patients who were given chemotherapy alone had a 5-year survival rate of 83%, which is already really good. But for patients who were given both chemotherapy and TAM, the 5-year survival rate increased to 91%. That is an 8% increase in the number of patients who survived. While targeted therapy is effective in treating many forms of breast cancer, it's not perfect. There are some types of breast cancer, such as triple-negative breast cancer, that does not seem to respond at all to these targeted therapy treatments. This is because triple-negative breast cancer's cell growth and division does not seem to be reliant on hormones like estrogen, but is instead caused by some other source. So there's still more work to be done on breast cancer treatment in order to fight these forms of breast cancer.